All right, we are going to be talking about the humerus today. This picture in the black details that this indeed is the right-hand side anterior view of the humerus. So this is the anterior side, this is the posterior side. We're going to start with where they have it in common, and that's right here. And this is the head of the humerus. And when we look at the head of the humerus, we know that we need to have a neck. And so you can see the neck more clearly on the posterior side right here. And this is actually going to be called the anatomical neck. And the reason for that is because we also need to have a surgical neck. And I didn't know this until my cat decided to break his arm, and they had to actually cut it right here and remove this entire portion, which my son now has in a jar in his room. But that's the surgical neck. So that's what they might use if they need to remove the head of the humerus. And you would see that potentially in shoulder replacement surgery. So there are two tubercles that run distally down the shaft from the head. This front part that you can only see on the anterior view is the lesser tubercle. And the one that can be seen both posteriorly and anteriorly is the greater tubercle. So then as we go down the shaft, distally down the shaft, we come to the point on the outside, the lateral side of the humerus bone, and this is the deltoid tuberosity. And it's at this point that the deltoid muscle attaches to the humerus. As we continue distally, we come to two indentations, and as we know, these are called fossa. And the first one that we come to that is medial is the coronoid fossa. Coronoid fossa. The second one, which is right here to the lateral side, is the radial fossa. Just below that, and you can see it on both the anterior and the posterior, is this tiny little half bow tie area, and that is called the trochlea. And its job is to articulate with the ulna. And just laterally, we have the capitulum. And the role of the capitulum is to articulate with the radius. When you go to the posterior side, there's another fossa right here, and this is our olecranon fossa. And as you can see in this picture right here, the olecranon is actually a portion of the ulna. And we call it our elbow, and it sits directly into that olecranon fossa. Now, this little part right here that you can see actually on both sides is called the medial epicondyle. And in the images below, you can see directly how the capitulum, the head of the radius, articulates directly with the capitulum, and the head of the ulna directly articulates with the trochlea. And on the posterior, the olecranon sits right inside that olecranon fossa. And this again is the ulna, and this is the radius.